awesome gal pal, Miss Elisabeth Mack of Holistic Caring, who is our clinical technician. How are you, Miss Elisabeth, today?
I am fabulous. Happy Wednesday to you.
It is. It is a wonderful day to be well on Wednesday. So, like there's so much to talk about. It's so hard to channel it down to, just a few things. And, you have such an incredible wealth of knowledge. How when you decided to learn about cannabis, you decided to learn everything about it. So I appreciate that so much. And for all of you who don't know Elisabeth, because you're following me, I really highly recommend that you go to Holistic's Caring page and you follow her and you follow Holistic Caring, and you also get yourself this book. Okay, this is one of the pieces that Elisabeth has done. Today we're gonna touch lightly on some of the programs she's created outside of this book. This is a program. If you have a desire to be a cannabis health coach, this is literally the most comprehensive piece of material. I want to make sure it's in the camera that I personally have seen. There's a lot of people out there trying to sell programs, but this lady right here, she's an actual nurse. She went to school, she's an MBA, and she knows a lot about medicine as well. So she put a lot of time, attention, detail, and most importantly, love into this body of work. And today we're gonna talk about the program that she created for people who are wanting to use cannabis as a way to combat and address their cancer. But before we get into the meat of the conversation, the real how-to, because Elisabeth is the nuts and the bolts of how this work, and I am the big, broad, sweeping sunshine part of it. So there's a couple things that we just need to say to cover our ass basically, and that is that we are not promoting cannabis as a cure for cancer. This is just a tool in the toolbox that people can use. We are not making any outrageous claims that if you follow our program, use our products, or read this book, you will be cured of your cancer. We are saying none of that. We are only asking that you take a minute within yourself, your time, your day, your thought process, and you think about the different ways that there are to treat yourself. So you are a plant. You basically need the same things a plant needs. Cannabis is a plant. So it helps feed your body like a plant. Now, cancer is a big, scary word. You hear it automatically, you feel like you were hit by a bus. It just comes with this horrible rollout of emotions. And, it's always good to feel what you feel. It's not good to unpack there though. So we would like you to just listen to us for the next 45 minutes, hour, collect information, see how this can help you make better informed decisions about your life and your health. So I know that every single person that's going to float by this screen, unfortunately, can name 5 people in their life who have cancer, who are either living with it, treating it actively at this time, or have died from it. So this is obviously a really big problem in our world. And when you think about cancer, it's something that's not just a physical anomaly in our body. It's something that's in all aspects of our life. We'll say, oh, it's like a cancer. And what that means is that a foreign subject will come into our life and just eradicate everything around it. So on that note, it's going to be a pleasant conversation because we want you to know that there is hope always. There is, as long as you are breathing, there is hope for your healing. As long as you are trying something new and you are drawing air, you definitely can improve the situation of your life. So, Elisabeth, what exactly, okay, but first, wait, before we get into what exactly is cancer, let's kind of recap what we did last week, because there's a lot of really important information like the endocannabinoid system and the CB1 and 2 receptors. So real briefly, can you just go over how we are designed to take cannabis in and how our whole body is literally designed to be healed from it?
Absolutely. Yeah, it's a pleasure. Just to recap where we left off last week, and for any new visitors to Clinical Alchemy today, we respond to cannabinoids, a cannabis plant, because we have an endocannabinoid system, a system that corresponds to the molecules and compounds that are in this plant because they actually mimic the endocannabinoids that we make endogenously in our own system, like you make endorphins. And essentially, this endocannabinoid system is a switchboard of control to make sure you have balance or homeostasis at the cellular level. And what that means is that whether it's neurological, immune, digestive, in the brain, in the toes, it can be affected everywhere. And so when we take in these compounds, it's helping to balance us. And so we want to start low and go slow, and work with this system like we would work with any kind of medicine, because cannabis is a medicine. And additionally, it can help with mind, body, spirit, unlike pharmaceuticals. And so that's the best thing about all of the plant compounds, because they nurture us back to health, bringing us back to balance very naturally.
Right. And that's what we want to be, is in balance, because when we are sick, we are out of balance. That is what's going on. And cancer, as Elisabeth is going to explain to us in just one second, takes our body completely out of balance. So what we are doing here with these weekly little chats is providing you content and information and choice, so you can make choices that will bring your body, your mind, your spirit, your life back into balance. And this is how we heal. So exactly what is cancer, first of all, and why is it rampant?
Well, let me talk about this from this standpoint for a moment. I'm not going to go full screen here. This is just a pretty picture about Cancer 101.
Right. So wait, let's just stop right there. So listen, we're going to give you a real light understanding of what's happening here. And I want you all to know, it's going to be in the notes. You are always going to be welcome to circle back to Elisabeth for a deeper dive into all this conversation. Okay. So just so you know that. Okay. Now.
But yeah, so just on a quick starting point, what is cancer, right? Cancer is, like cannabis, not just one thing. Cancer is not one thing. Cancer is an overgrowth of immune cells. Think about like an immune cell that goes rogue and loses its off switch. Every cell in our body has a start date and an end date. And with cancer, the immune cells basically mutate and they lose their off switch and they don't want to go away. And so they just continue to grow, and they take nutrients from other cells, and they get really abusive in the body. And basically, what we want to do is look at this as something that can be treated biologically, as far as, nurturing it back to health. But, cancer cells can happen anywhere in the body, anywhere that we have unregulated growth. They multiply, they divide, and the DNA copies make mistakes as they are spreading. And so essentially, just think about it: a regular immune cell that goes rogue, loses its off switch, and doesn't want to go away. So that's what cancer is in a nutshell. And what we want to do is assuage people's fears that this is something that is generally treatable in 2021. We have a lot of good medical treatments that, between surgery, chemotherapy, immunotherapy, radiation, working collectively together to help people in different ways of working with cancer. And the cannabinoids, we're going to talk about, do something very naturally. But if we think about, half of all men and a third of all women will get cancer sometime in their
lifetime.
Why
do you think that men, like that statistic is really interesting to me, because I always thought that women, because of breast cancer, ovarian cancer, and all of our endocrine cancers, I thought that we were the big winners with more cancer, but men seem to get diagnosed more than women.
Well, and let's break down why that might be.
Yes,
men have generally poorer health, poorer stress management, poorer diets, and poorer sleep. And so when we don't have good stress management, diet, and sleep, and exercise, and connection, and the things that we can do to keep us healthy, we can fall prey to cancer. And so men don't take care of their bodies as well as women do. So
all right, so we're going to have to really work with you, brothers, because you're really important to us. I always say men do three things in the world: heavy lifting, seed planting, and protection. So if your body is riddled with cancer, you are not going to be able to do two of those for sure. There'll be no seed planting, and there will be no heavy lifting. So we need you, brotherhood, to start taking care of yourself a little bit better.
Yeah. And cannabinoids help us with stronger self-care. So all sexes can start to take care of themselves better with, gentle nurturing of the endocannabinoid system. Because, when we think about it, that's if the endocannabinoid system is working, it's going to correct the imbalances. That's what it does. Think about the seesaw and the Goldilocks effect at the cellular level. The cannabinoids that we are making endogenously should be solving that problem and fixing this and not allowing cancer cells to grow. But if you do have disease, any kind of chronic disease, not just cancer, your endocannabinoid system isn't working well. So that's like
So people will say,
number one.
but Elizabeth, I've been smoking pot since I was 13 years old. How is it possible that I have cancer?
That's a good one. It's first of all the onset of how the smoking pot goes into the body is maybe not strong enough. It's not giving you the potency enough to regulate the endocannabinoid system. And so you might need to use internal methods like tinctures and edibles and well, not even edibles, but tinctures and oils. Melting it into the mouth is always going to be your number one way to get this into the body. But cancers can grow even with people that are using cannabinoids all the time. And so really, it behooves us to really be in check with our body, making sure that we're treating things as we can. And, and just to go back to cancer is not one thing. There's about 200 different types of cancer. Imagine that, right? So there's brain and liver and lung and breast and prostate and blood, etc. And, the cancer cells can spread through the lymph system and the circulatory system and go to other places. So, stopping there, it's like how many people have cancer that starts at one point and then gets to other spots. And I know you get a lot of people with stage 4.
Right. And there's a couple things, like Elizabeth touched on a couple things that we're going to tease apart here. So she talked about tinctures. Now, when you're using cannabis as medicine, the way that it breaks the blood-brain barrier matters. So when you're smoking pot, if you're into cannabis, you've heard about this thing called decarboxylating, right? Like you need to decarboxylate that oil in order for it to work. So when you smoke pot, you decarboxylate in the moment because you're you're bringing fire to the flower, you're breaking the bud, and you're dispelling it. So that is something that is not going to give you the entire plant compound in your body. So can you explain what the blood-brain barrier is and how it's affected, or how we affect it with cannabis?
Well, if you think of the blood-brain barrier, think about our brain. It has a film. Think about like the brain. It's encased in a film. So think about like saran wrap being on top of it, right? That could be the blood-brain barrier, and it's non-porous to most things. And in other words, nothing can cross that. It's very hard to cross into the blood-brain barrier. You have to have very small particles, and it's almost as if they need permission, knocking on the cells and saying, "Hey, I need to get in." So, when we're talking about cannabinoids, they do break the blood-brain barrier. When you get them in systemically, like through a good tincture or an extract, those cannabinoids can travel through the bloodstream, pass through the blood-brain barrier, and then into the brain. And then we are chock full of CB1, CB2 receptors through our brain.
So what if we do an edible? What if we're like, I really don't like the taste of the tincture. I want to encapsulate that medicine, or I want to eat a brownie. Does that affect the blood-brain barrier break differently? Try and say that 5 times.
Well, it might slow things down, because now we have to talk about pharmacokinetics. And what that means is like when these compounds get into the body, what does the body do to them? And, breaking them down and absorbing and metabolizing them and excreting them, they have to get to a certain potency before they can really tip the threshold in the blood-brain barrier. But when you think about edibles, you only get about a 10% absorption into the bloodstream. Whereas if you hold a tincture or a good oil in your mouth, it could be like 40-50% is actually getting into the bloodstream. So that's a big difference. So an edible, you would think that it's not going to get into the bloodstream and into the blood-brain barrier, but here's a real hitch that not many people know. When you eat delta-9 THC, it converts in the liver to 11-hydroxy-THC, which is actually a stronger compound and actually penetrates the blood-brain barrier easily. So it's not like you're getting it into the systemic circulation with the potency that we necessarily need, but edibles actually get to the brain really well because of 11-hydroxy. And that's just an interesting side note
Is
for
that
people
only
that like edibles.
Delta 9? So is that only when using Delta 9? Like if you're using a THC component or a product that's been created into Delta 9, like as opposed to an edible, like we make our edibles from FECO oil, fully extracted cannabis oil. Is it not as effective then as something that has been through this whole entire process and hexed into Delta 9?
Your edibles are probably going to be way more effective than the average chocolate bar that you're buying at a dispensary because it's made with FECO, because it's made with whole
So
plant
that was
oils.
my main question was like Delta 9 is the big buzzword. I personally am not a big fan of hexing plant material into powder, but I just like, it sounds like maybe it really does have some benefit. So I know that it's the big buzzword in the cannabis community for edibles. A lot of gummies are being made out of it. So it's more effective than spraying it with a BHO.
Right. And think about the economics, right? When you're looking at Delta 9 THC that is made into mass produced edibles in gummies and all of that, what are they using? Are they using FECO or are they using isolate? Are they using distillate? You're only getting 1 or 2 compounds when you're doing that through extraction, through CO2, through losing all of the other plant molecules. So, your edibles are going to be much more therapeutic and effective to people than the average run-of-the-mill edible.
And not just mine. So people who are making their products at home, it's really important that you understand if you were making a butter or you were making an oil and then you were putting it into an edible, you were making a much more powerful compound than something else. And because it's in your stomach and it's going through your gut, it's going to have a very different effect on you than whether it's in your mouth. So when you put something in your mouth and you break it in your mouth, the blood-brain barrier is pretty much immediate, right? Like you have that, like, you're high, like I'm high right now, okay? But if you eat an edible, depending on how fast your metabolism is, what's in your stomach, it could take up to 2 hours for you to really feel the effect of that.
Yeah.
Correct?
Yeah. So that's we'll have to go. One of these weeks we'll have another conversation on the pharmacokinetics, and we'll break down onset and duration and that sort of thing. But let's return to what cancer is doing in the body, and what cannabinoids might be able to do for them.
But wait, I had one more question before we get on to here, because I wanna just I talk about the ways that we break it up in the system. So go back to just your face, okay? Because I don't want to get people ahead of us, okay? So the other way that people use cannabis as medicine a lot is rectally in suppositories. So I want, like, what about breaking through cold? There's a lot, we're dispelling a bunch of myths here. People are like, oh, if you use it through the colon, you're not going to receive anything. If you go too far into the colon, you're going straight to the liver and you're basically not getting anything. So what is it about like breaking the colon wall into the blood-brain barrier? Because now we're talking about, we have the mouth, the stomach, and the exit point, which is also an entrance point. So what about that? What about using cannabis that way as a suppository?
Well, when we're looking at clinical therapeutics and research, what the scientists are finding is that the colon is not all that great a place to absorb oils. And cannabinoids are fatty acid lipid molecules that are a heavy oil. Cannabinoids are meant to be used, internally or smoked and that sort of thing, because they're absorbed better that way. When you put cannabinoids up into the rectum, it's not going to be all that well absorbed because the colon absorbs water. As far as
really important point, cannabis is not water soluble unless it is made that way. Okay, so on its own, it is a fat lipid. It is not a water soluble. So if you are going to use a suppository, you must make it with an oil, with a carrier oil. It has to be paired with coconut or olive oil or sunflower, I don't care, some kind of oil, or else you're basically just going to poop that stuff right out.
Yeah. Yeah, I mean, it might be, now let's look from a localized, if somebody has colon cancer or rectal cancer, or even prostate or uterine or ovarian cancer, and you want to absorb them right there locally, then that might be a good shot to giving, and also some comfort, right? It's going to be healing the localized tissues. Whether or not that's absorbing into the bloodstream and getting to the brain to help glioblastoma, we don't know. But for those folks, I would way rather see people taking a tincture or an oil orally.
But Elisabeth, I can't take 350 milligrams in my mouth.
Well,
what about your belly button? What about the belly button? How do you feel about belly buttons?
Well, you taught me that. We didn't learn that in medical school at all. As far as the absorption, that's some old world stuff. But why not if it can get in? But going back to 300 milligrams, you take it at bedtime and you go right to bed. You go to sleep and you allow yourself 10 to 12 hours in the bed. That's how you take 300 milligrams.
There you go. Perfect. Excellent. Okay, now we can move on with my favorite Justin Kander.
Yeah. So Justin Kander, let me go back to share. So he was running the lab science stuff over at Anzelda's for many years, and he wrote a book, Cannabis for the Treatment of Cancer, and this is on Amazon also. And he has significant research on cannabis and apoptosis from a molecular biology standpoint, and it essentially, to break down what this is saying, is that when cancer cells are exposed to cannabis, they experience apoptosis, programmed cell death. Remember how I said cancer cells lose their off switch? The cannabinoids might be able to reprogram that. And so cancer cells die, the healthy tissues remain, unlike chemotherapy, and the phytocannabinoids appear to be a biological ideal solution to cancer. In cell and animal models, cannabinoids exert anti-cancer activity against cancers, and their generalized therapeutic effects indicate they may fight all cancers at some level. So how fascinating is that, right? Now, when we talk about cell cultures and animal studies, that's still where we are with respect to looking at apoptosis. And not only are we not studying this in America, but even in Israel and Spain and Australia and some of these other places around the globe that are doing cancer research with cannabinoids, they're still in the cell cultures and the rodents.
And what was the name of that book again, Elisabeth? You took it off so fast. Can you put that slide back up?
Yeah, so it's called Cannabis for the Treatment of Cancer. Justin Kander is the author, spelled with a K. It's fascinating. When we think about apoptosis, let me just kind of go into this next slide and just talk about the 3 anti-cancer properties that cannabinoids have that also traditional chemotherapies have. Now, chemotherapy, they're trying to do the same thing. Trigger apoptosis or cell death, getting those cells to turn off again, and inhibiting angiogenesis or a blood supply. Think about the cannabinoids as being able to put cancer cells under siege and not allow them to get nutrients. And then anti-proliferative properties. So the cannabinoids go into those cells and change the genes so that cancer cells can't spread into the body and go elsewhere. So they stay more contained. So if cannabinoids can do this, they have very strong anti-tumor, anti-cancer properties, right? So, again, this is preclinical evidence, but, in all of the work that you and I have been doing over the years, how many people, are using cannabinoids for cancer and really extending and prolonging life?
Many. Yeah.
Right.
So I think that apoptosis is a really interesting thing, like when I've had clients, I had one client who was in Australia. She had a huge tumor in her womb space, in her uterus. It was like, a softball size. And when she went back to, after doing, treatment for a number of months, she went back to her oncologist, and the oncologist was like, oh, I think that the cancer is spread. And then he was like, oh, wait a minute. It all broke up on the inside. Like the external space of that tumor still existed, but the whole inside of it was gone. And that's really what apoptosis was. Is there anything else besides cannabis that can create that in the human body? And how effective is chemotherapy when it does it?
Right. Well, chemotherapy does trigger apoptosis. It does get those cells to die basically by dropping an H-bomb on them, right? So like where cannabinoids go in and surgically get into that cell and start changing things to find balance and make it healthy again, chemotherapy is like it just wipes it all out, and it takes out the cancer cells as well as everything else that is healthy around it. So, the ideal thing is to use cannabinoids maybe concurrently with chemotherapy. And that's one of the things I work with people all the time on, how to dovetail this and use it with chemotherapy, immunotherapy, because it's really a good complement for chemotherapy, because then guess what? You can tolerate the chemotherapy with less neuropathy and other things that go wrong, all the collateral damage from the chemotherapy. You can tolerate chemotherapy and not get the nausea and vomiting, so that you can still maintain your weight. And you can have a lot less pain as far as how you're tolerating that. But the other thing is, you might be able to use lower doses of chemotherapy if the oncologists are on board and they're listening to you and you're talking to them and saying, hey, I'm using cannabis with this, maybe we could use a little bit less. No, they're going to want to still use the whole dose. But if you have a good conversation, they might be able to drop some of that and give you less, just like when we can lower the opiate doses that people are taking when you've got cannabis on board, because it makes everything else stronger.
Right. And let's remember, people, your doctors are working for you. So if you have a doctor who's like completely anti-cannabis and you want to use cannabis as medicine, I highly recommend you get another doctor. Sincerely, because you're paying them. So there are many doctors out there now in the world. When I first started doing this, I would have doctors call me and they would say things like, I'm putting my license on the line, but I've seen amazing things in these children that you're treating. So now over the last 10 years, they're like, wow, this is really amazing stuff. So there are more, and doctors are younger as well, because, everybody's aging. So all these nice younger doctors are coming up into our view, and they're a lot more open to it. So don't be afraid of your doctor. Your doctor is, a lot of, I feel like we just have to talk about oncologists just a little tiny bit here for a moment, because they get such a hard rap. And if you're going to be an oncologist and a surgeon, you're just like a professional athlete. You are on track from the time you are like in 7th grade, because you need to hit all of those benchmarks in your learning to be able to get to medical school, to be able to go to your secondary training as a surgeon. And what happens is that your personality starts to kind of suffer, because you cannot develop all of yourself. It's not possible for anyone.
I think that's what happened to me.
You have lots of personality. We just have to let it out. You have a big brain, like lots of stuff going on.
I'm your little Vulcan.
Yes.
But let's talk about the oncologists. Let me go back to this, right? Because the oncologists are actually on board more than all the other physicians, because they see that cannabinoids are something that a lot of their patients are using, and they have to get on board. They have to listen to their patients. They have to support their patients. They can't be, negligent in this. And, when we look over at this side, the doctors may not have conclusive evidence on, inhibiting angiogenesis, being anti-proliferative, or triggering apoptosis, but they also see that the patients can use the cannabinoids to eat, sleep, relax, forget, and protect. That's what the endocannabinoid system does, if you remember from last week. But, when somebody is not eating because they're nauseated and they're vomiting, that has to be stopped. And Zofran and Ativan only go so far. We want to use cannabinoids to really tap that down. And it's twofold, right? It's stopping the trigger to vomit through the nausea pathways, but it's also inspiring the appetite to return and getting people to be able to take nutrients in, and that's huge. So
so I just have to drop in here and say appetite return. So just, oil like Feco oil and tinctures they don't really get the appetite stimulated like smoking weed. So honestly, the best way to get your appetite going with cannabis is really smoking cannabis, honestly.
Well,
why do you think that is?
Yeah, tinctures actually will, but it's not like immediately. It's not like an immediate cause and effect where inhalation might be. So when we think about inhalation versus tinctures and extracts, the extract and the tincture is going to trigger appetite, but it's going to be the next day or 2 days later. It's going to start to come back, right? It's not like when you smoke a joint, you're like, wow, I'm famished, right? It's a very different relevancy and timing. But tinctures and extracts do actually start to increase the appetite. And the other thing that was on that slide was, sleep. How many of us are not getting sleep? And cannabinoids at bedtime, especially THC, is going to trigger sleep. It's going to be sedating, especially at higher doses. So if we can get people to sleep, now guess what? That's where all the healing takes place. That's where your body's actually repairing, you're rebuilding bone, your immune cells are getting cleaned up and reset. And the cannabinoids are working while you sleep. So they put you to sleep and then they work while you sleep, helping reset things in your body. So sleep is huge.
Sleep is crucial. Sleep is crucial. I cannot express to you people how sleep is so crucial, especially if you are living with cancer. You really need to find that time to like sleep, because that's really how your body heals. Your body is not going to heal if you are at work. It's not going to heal if it's involved in a task. It's only going to heal when it's completely laying down, your eyes are closed, and your mind is let go.
Yeah. And, as far as dosing for sleep, with people with cancer, I always tell people after you have your dinner, have a light dinner or whatever you can get into you. And then an hour after that or so, 7, 8 o'clock, that's when you dose your cannabinoids and get in bed by 9 or 10 and just get some really great sleep. 9, 8, really stay in bed from 8 p.m. to 8 a.m. And use the THC to help you sleep, because that's what's going to help you heal. And be more functional in the mind, right? Think about how we are mentally when we're getting 2-3 hours sleep. It's horrible. I have had a lot of stress recently, and I've had many nights where I've gotten 2 to 3 hours sleep, and I don't function all that well. I can fake it, but at the end of the day, I feel like I'm going to die. You gotta sleep. People have to sleep, and it helps you be emotionally, and that goes, to the next thing that was on that slide. Emotionally, anxiety, depression, angst, agitation, that inner, like, you're just shaking inside because you're nervous, right? Cannabinoids tap that down, and now it's like, wow, I can breathe, I can be with my family, I can show up at dinner, I can watch a movie, I can actually laugh.
Right. I can get out of the headspace of I am in a position where I'm going to die, because that's what happens to us. Is we hear this information from our doctor, we go to the most cryptic place possible, and then we unpack and we just stand there. And then everything that's coming from it is all part of that. Like everything that happens out of that is that's rolling in the background the entire time. So let's talk about dosing for cancer, because dosing for cancer and dosing recreationally are very different animals.
Very different.
So
yeah, okay. So recreational dose, let's talk about THC. So 2 to 5 milligrams to acclimate, get yourself used to this, prime the pump, get yourself like where you're using it to just downshift a little anxiety, and maybe a little after dinner, maybe you're replacing wine, which is always a great thing. And have like 1 glass of wine instead of 2 or 3, have your 5 milligrams of THC. Right? No, I know. I mean, and think about wine. That is triggering cancer cells because the sugars promote inflammation, and they promote the wrong thing happening. So people that have been drinking a bottle of wine a day need to be able to get help to stop doing that. And cannabinoids can actually help decrease the cravings for wine. And so day by day, you can drink.
And all other alcohols.
Yeah, all alcohols and smoking and using other drugs. Cannabinoids can really stop that craving for all the other substances that might be harmful for you. But going back to dosing, right? So 2 to 5 milligrams is a starting dose for CBD or THC. CBD doesn't really matter. You can take CBD gummies, 10, 20 milligrams. There's no real guardrails with CBD because it doesn't make you high. But you don't want to overshoot it because it gets costly. But when we're talking about
Raphael, what does our guru say? 1,000 milligrams a day.
Raphael Mechoulam
says 1,000 milligrams a day.
The godfather of medical cannabis actually did say everybody needs about 1,000 milligrams a day of CBD, but obviously that's really impractical.
Right.
And we have no relevancy on whether or not that would really keep you humming and disease free. But it would be, a good sci-fi movie to explore. As people are taking CBD and then they never get sick, sort of like Soylent Green, and you got the little pills, right? Like I have no idea if it would have any truth to that. But with cancer dosing, we need to step things up, right? And so 10, 20 milligrams is a starting dose. And then every day or so, you're increasing. So before a couple of days, you're at 50. And then a few more days, you're at 100. So stepping up by 10, 20 milligrams every 3 days is about a good way to look at this. And when I think
so now we have these people, and anybody who's in cannabis medicine has had this client. I don't want to get high.
That's why you're going to take it at bedtime. You're going to have, but you're also going to act like if you do what I say and you go from 5 to 10 to 20 to 30 to 40 to 50, very slowly, you're not going to feel high. Are you going to feel a little buzz? Are you going to feel a little dizzy, a little woozy? Yes. But is it tolerable? Yes. And are you going to be afraid? No, not over time. And then, you get to about 50 to 100 milligrams, and that's a good dose. Now you can hold it there for a couple of weeks, taking it at bedtime, so you're not compromised. You're getting sleepy. You're getting some good sleep, right? And so now do that for a couple of weeks, and then see what we want to measure objectively from the clinical side, right? What's going on with your scans? What's going on with your blood work? What's going on with your functionality? Are you in less pain? Do you feel like, the tumors are shrinking and you have more movement and you have more energy? These are things that we need to talk about on the clinical side of adjusting these doses to see, if we're getting good therapeutic efficacy with that dose, to see if you need to go any further, because 100 milligrams is good. You mentioned earlier 350, which is also a good ceiling target for somebody that, let's say, is 150.
So let's go back to a gram a day. Now here's the conversation I hate more than anything. Well, I need to take a gram a day. So can we just all get on the same page that a gram is a weight of measure, and it is not a meter on how much you should put in your mouth. It is just a weight of measure. And if you do not have a tested product, then you don't know what's in that gram. So you do not need to take 900 milligrams of THC a day to create apoptosis, do you?
Right. Well, no, going back to the 350, the way that a lot of clinicians get to that is 5 milligrams per kilogram. So, right. So like if I'm 150 pounds, I divide that by 2.2 and I get about 64 kilograms, right? So 64 times 5 is going to be about 340, 350. And that would be your ceiling dose of cannabinoids that you need per day to try and trigger that potency threshold to get to apoptosis, right? And of course, you're measuring these objective things, your labs, your scans, etc., so that you see, do I need to go north of that, or can I hover a little south of that?
And how long before, here's the other thing is, I've been using cannabis for 3 days. I don't feel like my cancer has shrunk. Okay, so what is a realistic, I like to tell my clients 3 to 6 months of using cannabis along with whatever, medical forms they're using before they start to look at those scans to see a difference. What do you think?
Well, that's exactly what I tell them too. So 3 to 4 months for sure, that this is a commitment. At these lower, people come to me and they're like, I need to take a gram a day for 90 days because that's what's in the chat rooms, right? But I'm like, no, let's go to 5 milligrams per kilogram and hold that for 3 to 4 months and see objectively what's going on. See what's going on with your body. See how you're feeling and your functionality and that sort of thing.
Okay, just because we're talking to a Western audience, a kilogram is equal to a pound. Okay. Just so you know.
2.2.
So 2.2 pounds. That's what I meant. Like when she's saying kilograms, she's talking about pounds. So it's 2.2 pounds to 1 kilogram. So that's basically for every 10 pounds you weigh, all right, 5 milligrams of THC, right?
Well, 5 milligrams per kilogram, right? And so calculation, like if I'm 150 pounds, I divide that by 2.2 and I get 64. Right? That's the number of kilograms. So if you're 200 pounds, divide that by 2.2, and you're going to get let's just say 80, right? And then you times that by 5 milligrams per kilogram, going back to 64, that's going to be about 340. And that would be my daily dose. Now, the next thing is splitting that between CBD and THC. or CBG or CBDA or THCA or some of the other.
Okay, let's just not get into all the variants of strains. Okay, let's just stay with like we can lose people at like, well, do I take the CBD and the THC together? And if I do, is it bad or do I separate them?
Well, right, but let's address that actually. So
Okay.
the CBD generally I tell people to take in the morning because that's going to help unhinge some of the THC from the receptors. It's going to help you wake up and refresh. But also CBD, think about CBD being that antioxidant neuroprotectant I told you about last week, scrubbing bubbles, like going through the body, resetting and checking all your switches and making sure that you're humming right. And then THC that you give at bedtime is plugging into the immune cells that have gone rogue and trying to do their work. So you don't want CBD to come in and clean them off, right? So I like to give the CBD in the morning, the THC at bedtime, keep them separated. And the CBD count can be like 100 and the THC can be 250. In my earlier example, you don't need to have 350 milligrams of THC. You can have 100 of CBD and 250 of THC.
And what if I take them together? What if I put CBD and THC together and I take them at the same time? Then what?
Then you have a ratio. And that's great for people that are treating autoimmune conditions and pain and neurological things. But with cancer, I do like to separate them.
I do too. Yeah. I think it's really important because there's, we are multifaceted as human beings and we cannot treat ourselves one way. It's like if you showed up every single day and somebody gave you a plate of spaghetti, you would not be satisfied. Well, your 5 systems in your body, they don't all want to eat spaghetti and they all need something a little bit different. So today we're just focusing on cancer. So when, there's been so much misinformation, and I helped propagate some of it a while back from a study from Christine, what's her name, Sanchez, that she did in rats, where she found that THC was producing more estrogen, but then wait a minute, no, it wasn't. So for a whole moment, like literally a moment, like I think like 6 months, we were talking about how THC is the possibility to promote estrogen and should not be given to breast cancer patients who have estrogen-driven cancers. Well, it turns out that none of that's true. So CBD, cannabidiol, does not fight cancer, correct? It is not going to create apoptosis in your cell, correct?
I believe CBD is just as anti-tumor as THC. It's different in the way that it doesn't plug into those receptors. So it doesn't plug into CB1, CB2. So that's true. But CBD has anti-cancer properties because it gets in there and it helps change the genes so that they don't spread. It has.
So if I'm just doing CBD, you think I'm going to be able to treat my cancer? See, I don't agree with you on this. I think that if we're in a cancer fighting conversation, then you need to have the whole entire plant, which is everybody, THC and CBD. And if you just treat yourself with hemp derived CBD, that's something that, your uncle's brother, sister's cousin bought from you from the drugstore or online, you are not going to get the same result as using a whole cannabis plant, even if that is just CBD.
That's true. And that the cannabis CBD is going to be much more preferable than any kind of hemp CBD that you buy online because it's much more potent. It has all of the components that have been, and ideally ethanol extracted, right? So, we'll talk about extraction some other time, but ideally, the CBD is cannabis CBD, but it can do a lot of great things in the body with anti-cancer properties, but it might not, trigger the apoptosis like THC does. But with respect to dosing, on cancer, let's just talk about palliative dosing because not everybody wants to treat cancer aggressively with high dosing.
Right.
And going back to, starting at 5 milligrams, but then getting up to 10, 20 milligrams a day, 40 milligrams a day. What does that do? That's going to help you with the eating, helping you with sleeping, helping you with being relaxed, helping you be more functional, have a little more energy, be more at a good set point in your head and less anxiety. So that is a great way to think about cannabinoids as being anti-cancer as well, not just the anti-cancer properties from, the high potency dosing, but just supporting you in your quality of life, reducing your symptoms so that we can elevate the quality of life and your functionality.
Oh. So we're just going to be wrapping this up here in just a minute. So much amazing information. So I just want to spend a little bit of time because Elisabeth, you're such a freaking gem and you're so awesome and you have so much to offer so many people. I have to show the book again. And I know that this is not the cancer fighting. This is not the cancer module. Is it? Do you have that book around you that you could pick up and show? Or is that module in here?
I can show. So on my website, if you go to holisticcaring.com, so you just go there and then you hit patient programs, and then you can pull up all the different patient programs that are the self-guided healing programs. And cancer is one of our most popular ones. And basically what I do is talk about, what's going on in the body with cancer, much more in total, and teaching you, the difference in staging and all of the different cancers and how we treat them, and then all the side effects from treating cancer, and then what conventional medicine does to treat it, and then what cannabinoids can do, and some of what we talked about today, but I've elaborated much more. And then I break down all of the different routes of administration, different dosing protocols for each one of them, different cannabinoids, how you can shop, how you can understand what good FECO oil is and tinctures that follow the flow criteria, flower-derived, lab-tested, organic, and whole plant. That's going to be the best in medicine. And I teach people also functional medicine, how to use cannabinoids with breathing, with movement, with changing your diet to an anti-inflammatory diet. So this program is very robust. And we need to get this out to all the people in the world to talk about how this program can really guide people, and it opens up in an app. That's the other thing. Next time I'll show you how the app looks, and you can see the program, because it's really amazing and easy to learn.
And it's so awesome to be able to heal yourself, because I am a big fan of two things: healer, heal thyself, and teach a man to fish, don't give him a fish. So what we're doing here is giving you guys poles, okay? We're giving you poles and baits, okay? We want you to go out there, this body of work that my dear friend has created, holisticcaring.com. I just want to make sure that you hear that part, because, we are really about sharing information, not about selling. But Elisabeth has agreed to work with me, Firebird Touch Therapy, our product line, and to help our clients. So you can actually get a free consultation with her if you purchase her book and work your own program. She's going to help you create your own dosing program, because the thing that is really the saddest to me and the biggest waste is when people spend a whole bunch of money on a product they're not going to use because they use it one time and then they have a really bad experience with it because they get too high, they don't like it, all kinds of things happen, and this is a way to mitigate all of that. She's a healthcare coach. She's an actual RN. She's been in cannabis medicine for a long time, as well as clinical medicine. This is the woman who, when I'm creating a new formula, she is my go-to as far as how many milligrams per gram, what I should use it for, and where it's going. So she has a wealth of knowledge, and I'm really just so excited to be able to share her big ass brain with all of you, because there's so much, like I said, so much information, and all of you who are rolling through Facebook and getting in those groups and talking to all the armchair physicians out there and getting all this misinformation. You are not helping yourself, you are not healing yourself, and you are putting yourself at risk, because time is of the essence, especially if you are dealing with a life-threatening illness. So just push all that aside. Don't get out there and keep digging through the forest. We have the truffles right here for you. And we want to help you because we love you. And we know that if each one of you takes care of your own circle, then we're ultimately going to heal the whole planet. Because if we all just do our own work, there's nothing left for anybody else to do. So this is a way that we can all keep our own backyard clean, our own health clean, and be nice to our oncologists and help educate them as well. So is there anything that you'd like to say, darling?
Well, did I ever tell you that back in 2014, when I was still running sales for Anthem Blue Cross, I went to a workshop and we were writing a personal mission statement. And back then I wrote that I would like to, my personal mission statement is to envision, engineer, and encourage health and wholeness through logic and spirituality. I had no idea what that meant, But when I think about envision, engineering, and courage, that's what I do every day. I envision it, I figure it out, I engineer it, I work through it, and I encourage people, supporting them and guiding them. And then through logic and spirituality, that's the art and science, right? And so this plant is art and science. This is clinical alchemy. This is a new forum into a paradigm of healthcare that we've never seen before, but it excites me to no end. And I couldn't be more happy to be here.
Right, we've never seen it before except for 10,000 years ago when it was the baseline for all medicine. So, you know, everything is a circle, we all come back, and here we are again. I'm going to show this book one more time. You can get this book actually on Amazon, but honestly, reach out to her at holisticcaring.com. You know, like really, you're just getting like the tip of the iceberg on how much information there is here and how well you can help yourself and heal yourself. And you don't have to be afraid of cannabis as medicine. You know, like she said, take it at night. You're still able to have your day function. You know, you might need to start work a little later or go to bed a little earlier, but you're still going to be able to function. And you know what? After you get past the part where you're uncomfortable, where it makes you a little dizzy, where it makes you a little nauseous, where you feel a little out of control, which doesn't last for very long. It really doesn't, maybe 3 to 5 times when you use it. And I always say, take more. I would say if you hit that point where you feel dizzy and nauseous and you don't like it, take more, because it will put your ass straight down. Okay. And that's really what you need, is just to take more. But if you can get yourself past that part, then you're going to have a functional medicine that you can use with whatever allopathic choice you want or not. That's going to help your entire cell system and your whole body to have a better experience of this journey that we're on called life. You know, nobody gets out alive. We're all going to die. There's no way to mitigate that end story. However, along the way, we are here seeking pleasure and knowledge. And that's what we're trying to give you, some knowledge, so you can go out and have some pleasure and be pleasurable. Okay. And then the other thing I just want to say, which has got nothing to do with cannabis, but it does regenerate the entire cell system every time you do it. And that is have an orgasm. So make sure you are on that magic button, okay, at least once a day, and letting all of that just flush through your neurological system and open that heart space for receiving the beautiful healing that the Creator has for you. So I'm Robin Swan. I'm Firebird Touch Therapy. This is my beautiful friend, Elisabeth Mack from Holistic Caring, and together we are Clinical Alchemy.
Yay. Namaste. Thank you so much for joining us another week, and visit us at Holistic Caring and Firebird Touch, and we'll talk to you soon.
And next week, we're going to talk about drug addiction and opiates. What do you say? Should we do that? Let's do that. We're going to do that next week. All right. How to get off like opiates, heroin, meth, and not using cannabis as a gateway out.
And I will have 3 slides again, not to overwhelm it.
3, yes. Okay. All right. But if you want the whole slide thing, if you want the whole enchilada, which I can't even recommend enough, definitely reach out to this lady and get the whole meal.